For your near perfect minute, I'm Dr. Jean-Marc Slak. Now, there's a question we get very often. A lot of people don't really know when to use heat or ice. So I am going to give you the answer. Heat has a physiological effect that is very powerful, and what it does is it softens soft tissue, it helps the muscles relax, and it brings about comfort. It feels good, and it increases blood flow through the tissue. So for the short term, heat might feel really good. In the long term, at some point of rehab, heat might be appropriate. However, there are some side effects to heat, and it's pretty tricky to pick the right time to use it. On the flip side, ice is going to decrease pain. Ice is going to decrease inflammation. Ice is going to help muscle spasms go away. It forces the muscles to stop spasming out. When used in appropriate amounts, icing essentially has no adverse effect if you make sure that you don't get a frostbite by having the ice directly on the skin. So if you insulate the skin from the ice, it actually is going to be beneficial almost all the time. So my recommendation, if you're hesitating between ice and heat, use ice unless you know better. Ask your doctor if you really want some precise answers. Most of all though, if you feel that you need ice or heat, make sure you've seen your chiropractor, because your body's innate ability to heal itself needs to be turned on, and chiropractors do that through adjustments. So here are all your answers, everything you ever wanted to know about heat and ice. For your near perfect minute, I'm Dr. Jean-Marc Slak.